Chapter 16, Segment 3, pages 516 through 523. Mood disorders are a major psychiatric category. Depression is most common in people over the age of 40, especially in women, and it can affect people of any age, race, or ethnicity. Depression is the most prevalent mood disorder. Depression is portrayed by an unhappy mood, a decreased appetite, a loss of energy, loss in interests, difficulty with regards to focusing, and restless agitation. Unipolar depression is depression that alternates with normal emotional states, and it can occur without any apparent stressors. About 80% of individuals that commit suicide are significantly depressed. Many suicides are impulsive acts. A study found that of over 500 individuals that were prevented from jumping off the Golden Gate Bridge, only 6% of these individuals actually ended up committing suicide later on. If suicide is prevented the first time an individual attempts it, the likelihood of them attempting it again is very low. Inheritance is an important determinant of depression. Depression disorders have a strong association with hereditary contributions. The concordance rate for monozygotic twins is 60% compared to the rates of dizygotic twins, which are 20%. Adoption studies show that patients with depression are more likely to have a biological parent with depression compared to the foster parent. Many genes make an individual more or less vulnerable to depression, and the surrounding environment is a determinant if depression will appear in an individual. The brain changes with depression. PET scans of depressed individuals show blood flow increases, which suggest a higher level of activity in the prefrontal cortex and the amygdala compared to controls. Blood flow also decreases in the parietal and posterior temporal cortex, as well as in the anterior cingulate. These of which are all systems that have been associated with attention. The increase in blood flow to the amygdala, which is involved with facilitating fear, continues after time, even after depression has been alleviated. Individuals with ancestors that had severe depression have been demonstrated to have a thinner cortex across a large area of the right hemisphere, and this suggests that this may make an individual vulnerable to depression. Many studies also report reduced hippocampal volume in individuals with depression, as well as reduction in activity of the hippocampal area in depressed individuals during memory tasks. A wide variety of treatments are available for depression. Electroconvulsive therapy is the intentional induction of a large-scale seizure. This is utilized when treating severe depression. Usually it's drug-resistant as well. This may work by decreasing functional connectivity between the prefrontal cortex and various other cortical regions. Transcranial magnetic stimulation is a modern technique for altering cortical electrical activity. This is being investigated as a potential depression treatment, but it does not appear to be as effective as ECT. The most common way of treating depression today is via drugs that affect monoamine transmitters. The monoamine hypothesis is suggested by the first-generation antidepressants, which were monoamine oxidase inhibitors. These are enzymes that normally inactivate the monoamines, norepinephrine, dopamine, and serotonin. MAO inhibitors increase the level of monoamines that are in synapses, suggest that the individual with depression do not get enough stimulation at these synapses. This could potentially explain why reserpine, which reduces norepinephrine and serotonin release, can cause depression. Tricyclics. These are second-generation antidepressant, follow the monoamine hypothesis because they inhibit the reuptake of monoamines, which in turn boosts their synaptic activity. Serotonin may play the most crucial role among the monoamines with regards to depression, which led to the major class of modern antidepressants, which are SSRIs. SSRIs, or selective serotonin reuptake inhibitors, are drugs that block the reuptake of serotonin, and they have little effect on norepinephrine or dopamine synapses. SSRIs are more effective than MAO inhibitors and tricyclics, and they also have fewer side effects. In rats and mice, SSRIs increase hippocampal neurogenesis, which may facilitate some of the mood effects of the drug. Also increases in the production of brain steroids like alloprogenolone, which may potentially contribute to the effectiveness of SSRIs by stimulating GABA receptors and reducing anxiety. There are problems with the idea that a reduction in serotonin stimulation causes depression. SSRI drugs increase synaptic serotonin within hours, yet it takes weeks before the brain responds to the increased levels and thus alleviates the symptoms. One suggestion is SSRIs immediately improve a person's emotional outlook, and that a few weeks of experience this, more positive outlook is required to overturn symptoms of depression. So, even though increasing serotonin helps some individuals, their depression may have originated by some other factors in the brain. SSRIs help many depressed individuals, but they do not help them all. In a placebo-controlled trial, a greater portion of people taking the drug report relief than do not, but about a third of individuals taking the placebo also report feeling better. This suggests that some individuals that take SSRIs experience relief from the placebo effect. There is no evidence that SSRIs, or any other antidepressant for that matter, do better than placebos when given to children and teens. Yet millions of children in America receive prescriptions for SSRIs. SSRIs also increase the risk of suicide in children and teens. Various over-the-counter drugs can potentially synergize with these drugs and push synaptic serotonin levels too high, which will result in a serotonin syndrome, which causes confusion, muscle spasms, and fever. The glutamate receptor's antagonist, ketamine, and the hallucinogen, psilocybin, are being investigated as potential antidepressants. Vagal nerve stimulation is also used as a treatment for depression. Electrodes are surgically wrapped around the vagus nerve in the neck, and a pacemaker mildly shocks it at certain intervals. This treatment is expensive, and there is little evidence to support it. It is also hard to evaluate because the trials have had few participants, and most have no placebo control. Deep brain stimulation. An electrode is surgically implanted in the brain and mildly stimulates various sites throughout the brain. Cognitive behavioral therapy. Psychotherapy aimed at correcting negative thoughts, reducing stress, and improving interpersonal relationships. CBT is about as effective as an SSRI treatment, but the rate of relapse is lower for CBT compared to that of SSRI treatment. But when the two are utilized together, they prove even more effective than either one just alone. The hypothalamic pituitary adrenal axis is involved in depression. Cushing's syndrome is an individual with significantly high levels of cortisol are prone to depression. It may have several causes such as hormone-secreting tumors or therapeutic treatments with synthetic glucocorticoids. In more than 85% of individuals with this condition, depression onset is early, even prior to the typical signs such as obesity or unusual growth and distribution of body hair. These observations led us to believe that the dysfunction of the hypothalamic pituitary adrenal axis is involved in depression, possibly as a depression-inducing stress reaction. Individuals that commit suicide have high levels of cortisol circulating, and hospitalized patients with depression demonstrate elevated cortisol levels as well. This suggests that adrenocorticotropic hormone, ACTH, is released excessively by the anterior pituitary. Dexamethasone suppression test is a standard method for assessing the hypothalamic pituitary adrenal function that can reveal if there is a tendency to release excessive amounts of cortisol. Dexamethasone is a concentrated synthetic glucocorticoid that is typically suppressed the early morning rise of ACTH that is normal in most people. When given late at night, dexamethasone seems to make the hypothalamus think that there is a high level of cortisol circulating. In healthy individuals, dexamethasone suppresses the release of cortisol the next day, but this effect fails in depressed individuals. As depression is relieved, dexamethasone suppresses cortisol normally, no matter what causes the relief. So why do more females than males suffer from depression? Studies from all over the world demonstrate that More women suffer from depression than men. In the US, women are twice as likely as men to suffer from major depression. Some researchers suggest women seek help from treatment facilities more often than men do, but sex differences in the occurrence of depression appear in door-to-door surveys. Researchers also suggest that the endocrine physiology difference plays a role because of the occurrence of depression is often related to events in the female reproductive cycle, for example, before menstruation, during the use of birth control, post-childbirth, and during menopause. Postpartum depression is depression either immediately before or after childbirth. This suggests that some combination of hormone can catalyze depression. Approximately 1 in every 7 pregnant women will exhibit symptoms of depression. There is evidence that prenatal exposure to SSRIs can potentially affect a child's behavior later in life, and it is unknown if SSRIs in breast milk affect the child. Sleep characteristics can affect disorders. Trouble falling asleep and staying asleep are common symptoms of depression. EEG sleep studies show that individuals with major depressive disorders show a significant decrease in stage 3 of slow-wave sleep, as well as an increase in stage 1 and 2. Depressed individuals enter REM sleep a lot quicker after sleep onset, and their REM is typically intense. The latency to REM sleep correlates with the severity of depression. Temporal distribution is also shown to be irregular, with an increased amount of REM sleep occurring in the first half of sleep. There are also correlations between depression and seasonal rhythms in a condition called seasonal affective disorder. Scientists are still searching for animal models of depression. Many signs of depression are obvious with regards to behavior. For example, decreased social contact, appetite changes, and alterations in activity. Learned helplessness is a type of stress model where an animal is exposed to a continuous stressful stimulus that it cannot escape. For an example, an electrical shock. Learned helplessness has been linked to the decrease in serotonin and dopamine function. When the olfactory bulb is removed from rodents, they display irritability, preferences for alcohol, and elevated corticosteroid, all of which are reversed by many antidepressants. The Flinders-sensitive line is a strain of rats created through the selective breeding that show a reduction in locomotor activity, reduction in body weight, and an increase in REM sleep, learning problems, and exaggerated immobility in response to chronic stress.